I practiced orthopedic surgery for 25 years in Wyoming, so I've seen healthcare from that side. My wife is a breast cancer survivor, 3 operations, 2 rounds of chemotherapy, radiation therapy, so we've seen healthcare in our family from that side. So I think we have a good overview of what works, what doesn't work. Additionally, a lot of my practice, even though orthopedics, was also aimed at helping people stay healthy. For 25 years, I've been on television in Wyoming and on the radio with a daily health report. I continue doing those now. And I sign off each one, say, here in Wyoming, I'm Dr. John Barrasso, helping you care for yourself. It's about personal responsibility, giving people information they can use to keep down the cost of their health care. Additionally, I've been the medical director of something called the Wyoming Health Fairs, something I do as a voluntary basis, and we have health fairs all around the state where people can go and they get their blood tested ahead of time, and then they go to the health fair and they get an envelope with their blood results in, and we have doctors and physicians' assistants and nurse practitioners there to help people go over them, to see what they can do in terms of their diet, trying to get their blood sugars under control, checking their thyroid, men with PSAs, people with cholesterol. And we started doing this, we didn't even know there was a difference between good cholesterol and bad cholesterol. Now we know all of those things. And we partnered with the state of Wyoming so that state employees could get the blood tests, which are very inexpensive, much cheaper than if you went to a hospital or ordered the test individually. Much cheaper. The state of Wyoming, for all state employees, will pay for the test. The only people we have trouble with, the only folks we have trouble with in terms of paying the $18 for all these blood tests is Medicare. It's the federal government. We've been fighting Medicare now all of these years. Medicare said they will not pay for any of these things because they're felt to be preventative and screening. So if somebody on Medicare comes in and says, I feel a little lightheaded, I can order $1,000 worth of blood tests on them. But they won't allow us to order tests on all of the people that show up at the senior center for cheaper than testing one person, because Medicare, to me, has been terrible in terms of anything that coordinates care or prevents care or prevents disease or aims at screening or early detection and prevention. So when we take a look at what government's role is going to be in all of this, I have great concerns. Now, we're going to supposedly get the score today on the Baucus bill. I don't know what that's going to be, but what we do know is that whatever comes out of this Senate is going to cost about $1 trillion. There's going to be about $500 billion in cuts, $500 billion in cuts to the people who depend on Medicare, and about $400 billion in increased taxes. So, you look at all of those things, and there is certainly the threat that people are going to have to lose the care that they have now. So those are the challenges ahead, and the president asked for constructive ideas. I said, yeah, let people buy insurance across state lines, get more competition that way. Let individuals who have to buy their own insurance get the same tax relief that big companies do who provide that insurance. Put in some component of wellness that's individually directed to give the individual some incentives to stay healthy and let them benefit from that, rather than all this money that's in to build jungle gyms and street lamps and roadways. And then deal with lawsuit abuse, which really is not in any way dealt with within any of these bills. And then finally, let small businesses gather together and group together to collectively purchase insurance and get better deals in that. I think we can do a lot without a significant government takeover of healthcare, which is the way I see it going right now. Thank you.
Thank you, sir.